Greg Wolfus, DVM, is a veterinarian at Tufts Tech Community Veterinary Clinic and a lecturer at the Cummings School of Veterinary Medicine at Tufts University. He is one of the founders of the Community Training Clinic. He and his team rescue animals every day. Over the past 12 years, they have refined their processes to perfection.
These are our cages. Again, you need to store animals at some point in time. Our space for today, our top shelf, and this fellow down here, he's getting sedated for x-rays. That's the animal that is having the dental procedure. So you can see we've got 5 cages here at Tufts Tech, and they're usually maxed out. We're blessed to have an electronic medical record system. So each one of our rooms does have a computer and a telephone. But if somebody doesn't have an electronic medical record system, those things are not necessary in the exam room. So additionally, in our charity clinics, it's critical that we have basic microscope. We also have an incubator for checking urine cultures, and then quick dyes for basic cytology, ear cytology, and skin staining, along with some fine needle aspirates if there's a mass or something else going on.
Animals at Dr. Greg Wolfus' community clinic receive a full range of services. Along with current doctors, student doctors also help to save animals.
As far as that animal is here for a dental procedure to have teeth cleaned and extracted. Over here we have a cat spay and a cat neuter, and those are going to happen, come this way, in the surgical operating theater. The students set up their trays to prepare for their surgery. We have anesthetic machines, we have appropriate monitoring, we have fluid pumps, we have the ability to heat the animals while they're under anesthesia so they stay warm. Another heating device, instruments, cupboards and storage for surgical instruments. We do have cautery for complicated surgeries. And then behind you we have surgery, suture, suction, ability to check blood pressure and monitor end-tidal CO2. The other thing that's really, really important, having a good surgical light is necessary to see what we're doing.
Dr. Greg Wolfus strongly believes that a similar charity clinic should be set up in Ukraine.
I think it's so critical with the recent devastation that's happened in Ukraine that we not only have a place where people can get care for their animals, but also a place where students and veterinary professionals can learn how to care for those animals. So the most important thing in a charity clinic is to have a general practitioner, a clinician who does all basic veterinary care, and then specifically somebody that's comfortable with dermatology, something that's comfortable with eye problems, someone that's comfortable with basic surgical handling skills. In addition, services, it could be dermatologists, it could be surgeons, eventually it could be dentists, stomatologists, those types of people. I think as far as space, these charity clinics really should be 3 exam rooms so that you can have a good flow of patients. They absolutely need to have an operating theater where procedures can be done, and they also need enough space to both have multiple people in the room for training, but also have enough basic equipment to meet those basic needs. In the last 12 years, I have had the blessing of helping many different schools in the US, but also internationally, create community or charity clinics whereby they find out what is most needed in their environment. And I think it's really, really important for everyone to understand that without the donors who are there to help the Ukraine Charity Clinic, or without the donors to help create Tufts Tech, none of this would be possible. So one of my former clients before I started Tufts Tech was a beautiful woman named Janice Kalkin. Janice Kalkin has now passed away, but before she passed away, she gave $250,000 US to start this clinic.
Why do you want to be involved in this project, and what is your main hopes for this project in Ukraine?
So the main reason I want to be involved is because we're all human. And I live in America, I was born in America, but my ancestors are from Uman, Ukraine. My grandpa's from Uman, my grandma's from Odessa. In any case, My family moved for persecution reasons and went to Argentina before coming to America. The minute I see tragedy happening in Ukraine and the minute I meet Vlad and Natalia is the moment that I know that I need to do something to help the people, the animals, and the veterinary profession in Ukraine. And my only hope is that we can not only help the animals and make the world see the horror that's happening, but also help prepare all of the future professionals to be able to handle what comes their way.
Currently, USAVA is working on establishing a charity clinic in Ukraine, but this requires funding and donors who care about animals. Anyone can join in. Every hryvnia, every dollar is important and will help save the lives of four-legged animals.